Hello, everyone. Welcome. I hope everybody's safe and doing well. As I promised, I'm here at 3 o'clock. 3:03, sorry. Let's see. Hi, Muzna.
Hi, how are you?
Hi, listeners. Hi, viewers. Hi, everyone. Welcome to the live session today. Thank you so much for joining in. I want to thank you, Muzna, for joining in always and, informing the community about what's happening in the medical field, what's happening at the hospitals. You're there firsthand. So please give us your introduction and your credentials so everybody knows what do you do.
Hi, I'm Muzna Atif. I'm a pediatrician and I work as a pediatric hospitalist. I'm affiliated with CHOC, which stands for Children's Hospital of Orange County here in Southern California.
Yes, and Dr. Muzna Atif has been with us many times addressing issues that, the community is affected by. And we always have informative discussions, and it's always good to have questions from you guys and, to get more and more engaging discussion going on. So right now, as everybody knows, the only discussion is COVID-19, COVID. That's all that's on everybody's mind. You've been dealing with it firsthand. Please tell us a little bit about it. Like, how is it? What's the situation now in the hospitals? Because we know the curves has flattened in many places. However, we have new concerns with people not following social distancing and other social things that have affected our environment.
Right. So you have to remember, Busha, there's always a lag time between time of exposure to onset of symptoms or people showing up positive. So because of that lag time, that 2-week lag time, we are still in good shape in terms of the number of patients that we're seeing. They have been downtrending a little for us as a result of the strict social distancing practices that we had practiced previously. There is a little bit of anticipation that maybe over the next couple of weeks, things might change a little as a result of people going out a little bit more and people not following the strict rules that they should have been. So we will start seeing those numbers, we're thinking, maybe in the next 2 to 3 weeks.
But as of right now, it was kind of, the curve had flattened a little bit in California side, right? Correct.
Yes.
Okay. So now that we are actually in the phase of everything is opening, phase 1, phase 2, slowly, gradually, states are reopening workplaces, worship places, places of congregation, So what are the protocols besides just the social distancing?
So that is going to depend. I mean, there are some general guidelines which has been repeated again and again, but then there will be some individual guidelines by those individual institutions on how they choose to follow the general guidelines or how they feel that their community will best follow or interact with those guidelines. But again, yes, when you talk about opening places of worship, being in a closed room area with a huge number of people side by side is definitely going to be a risk factor because the virus is not going away, the disease is still there. So what they would probably be implementing or trying to implement would be that they may not have 100% capacity. They may say they will only allow 25%, let's say, people to enter their place of worship, and they will have marked areas where people can distance themselves. Like when you go to a grocery store these days, there are marks on which you stand 6 feet apart. So probably you might expect that they may have marked areas where people can distance themselves. And of course, they may require people to mandatorily wear masks while they're indoors to prevent the spread from the people entering those.
Right. And I would like to ask everybody, like, how safe are they feeling? I'll tell you, like, when I go to grocery stores, I have my mask on, I have my gloves on, but I'm observing people being very careless. Like, people are not being as careful as they were in the beginning because we were all more afraid, and now people have gotten used to it. But they have to understand that the virus hasn't gone anywhere.
Yes, the virus has not gone anywhere so far. It's still there. What flattening the curve basically means is that the number of cases that was increasing incrementally, that is decreased. So now the healthcare systems are not overwhelmed by getting like 1,000 cases a day. Just this is not a true number, just saying, just for example, as opposed to maybe getting, let's say, 100 cases a day, which they can maybe manage more easily. So it's just decrease the number of people that are falling sick, but the disease, the virus activity is still there.
So the decreased number is because of the social distancing.
Correct. The social distancing and people covering their faces and nose with masks so that when they are breathing or talking or coughing and sneezing, they're not dispersing the virus particle.
So I'll speak also in English and Urdu because we have different viewers. And what Dr. Muzna कह रही हैं कि क्योंकि हमने social distancing follow की है, क्योंकि हमने mask लगाए हैं, क्योंकि हमने सारे protocols follow किए हैं, like wearing gloves, wearing masks, cleaning our environment. That is why the numbers have gone down. However, the virus अभी भी हमारे around है और अभी भी हमें continue करना है to follow protocols, to follow the safety measures. And viewers, if you have any questions, please do address Dr. Muzna. Mehreen is saying, hello, Mehreen. She's saying people are just tired of the situation and are more relaxed, which is alarming. Absolutely. I think it is alarming because now people are out there protesting, which is also needed, but I wonder what kind of effect that is going to have on the virus itself. So it's a double whammy kind of right now. Hi, Aspen. Hi, Jamil. Hi, everybody. Hello. Thank you for joining in. So, Hamabiba, we were talking about what the protocols should be post lockdown, and Dr. Muzna was telling us about that. Many facilities have prepared for that, but it's up to the people if they follow the rules, and it is. Can you tell us how important it is to follow these rules?
It's very important. Like someone just commented that people are probably just getting tired of all of this and going back to normal life. So if we want to resume normal life, because we know right now, we know the virus is not going away. It's there. Maybe it's not infecting that many people because we have done some mitigation strategies to decrease the spread. So that's important. If we want to return back to our normal lives, it'll be with a change. It'll be a new normal for us. So yes, for a couple of time frame, and I don't know what that time frame is, we will probably have to live differently with masks on our face, keeping distant from people, avoiding large gatherings until we can come up with something definitive that can be given to people to cure the virus or take it away, like a vaccine, and we can vaccinate people.
Right. So many of you have gone back to work now. I know so many of your friends are actually back at work. Are you guys seeing safety measures being followed at work? I would like to hear from you and to see if states are actually following, are people actually following? Because I know there are systems in place, but then if the people are not following, then, things can get worse again. Do you think so, doctor?
Absolutely. Things can get worse. There's always a chance that there can be little pockets of hotspots, depending on how the people in that area are behaving and depending on how strict the regulations of that area is. So yes, classic examples are, you may have heard in the news that there was a birthday party and then there's all of a sudden all these cases, or a funeral people attended and all of a sudden within a couple of weeks you start seeing a spike because all the people that attended were in close proximity and maybe they were not following all the measures.
Right. Do you think it's too soon to reopen?
I guess I'm not the one to make that call. That
Again, what is your personal view on this? Because this is a discussion.
My personal view is that if there is a community or an area where they are definitely seeing a downtrending in number of cases, and that is over a period of 2 weeks, because 2 weeks is the time in which if anyone catches the virus, you should start seeing manifestations of illness in those. So for 2 weeks straight, if you see a constant downtrending in the number of cases, then I think it is safe in that community or that area to start opening things up with the precautions or restrictions or instructions that should be provided to them by their local authorities to prevent it from going back up.
Right. I was I've been listening to a lot of live talks, because that's we have a lot of time. So I was listening to one commentator say that we had the practice of staying home. You guys did not, of course. You guys were at work. Thank you for that. I do want to thank all the frontliners who've been there. Really putting themselves at risk. So, he was saying that, we have had the practice of social distancing. We've had the practice of putting the mask on. We've had this practice. And now they're saying, okay, take that, what you've learned, and implement it at the workplace, and implement at the grocery store, and implement it everywhere else you go. So that has been a good thing for everyone, even though, we're not, this is still doesn't feel normal, but this is the new way of life for now, at least. So at least that is good. That much is good that we have had the practice of, and I'm really surprised at how resilient and adaptive human beings are. Like, now hugging someone feels unnatural, all of a sudden. So, so this has been working, the implementation of social distancing, the implementation of safety measures. So, so I wanted to ask you. We talked about how safe is it going back to work. It's all only depending on the practices that people establish. How do you think the COVID has affected people mentally? How has it affected your patients? What are you seeing there on the mental level, on the mental health of people?
It's had a very big impact in people mentally and the overall society. So my patients I'm a pediatrician, so I see kids, I see teenagers, and I've come across a lot of teens, especially who are going through a lot of social or behavioral changes as a result of this, because they're not getting to do they're not getting to follow their normal routine. So they don't get to go to school, they don't get to spend time with their other friends, and at that age they are very much peer dependent. So we're seeing suicidal ideation in teens. We're seeing a lot of teens as a result of breakups among them because of this social distancing, that they're coming in with suicide attempts. In the littler kids, because sometimes they don't know how to express, or they may not be able to express, so you see them coming in with physical symptoms in their body. So they have vague kind of aches and pains, or vague symptoms, because they're not able to express what they're feeling, but they're not able to understand what's going on, and they're not able to express their feelings. So it's very difficult for the younger ones.
Yes, it's a very sad time, but at the same time, we as adults have to really understand that this is really affecting the younger generation. They are isolated. They're not able, they're not going to school. I mean, some of them are really happy about the fact that they're not going to school, but still they need the human interaction. They need the social gathering. They need their peers. So, we will be in the future doing some programs talking about what can you do with your teenagers? What can you do with kids? And this is so interesting कि जो छोटे बच्चे हैं, उनमें you're seeing some physical manifestation of symptoms, and it's they cannot explain what exactly it is. So what do you do in that instance, Dr. Muzna?
So, as a physician, what I would do is first I make sure that if a little child comes in with any physical symptoms, that it isn't due to any organic pathology or something really going on with their body, that they're having the symptoms. But once everything is ruled out and we know there's nothing wrong in their body system which is causing the issues or symptoms that they're having, then it's just a lot of counseling with the parents, providing them support, having the parents know that they have to talk to their child in a way that the child can understand what's going on, and then offering them support services to help their child get through it.
I know teletherapy is really taking off. I know that a lot of online classes are, becoming available. There is so much online resources, guys. Tap into that. Aspen is saying, we'll read a few comments. Do you want to go ahead and read a few, Dr. Muzna? We have a few comments.
Sure. So So I just see some comments. So someone is saying that people are not even keeping 6 feet distance in the grocery stores, which I agree some are not. But that again goes back to everyone being a little selfless and thinking about others around them and thinking that their actions will probably save someone or protect someone who's around them.
Yeah, it makes me really nervous though, but I am really surprised at the ignorance. I would call it ignorance. I'm really surprised. Like, I am still like not full blown going to public places such as grocery stores and banks and things like that. But when I do go, I see people pushing up against you and you're like, what's going on? I am really surprised. I want to know, like, what is their mindset? Like, why are they behaving that way? Any guesses on that? Why do you think, guys, why are some people, we are almost being divided into mask wearing people and non-mask wearing people, almost like that. So I'm just wondering about what is all that about? What is the mindset of these people who are not wearing masks, who are pushing up close to you? What do you think? What's going on?
I think a lot of people are just being ignorant about it. A lot of people are not coming terms to reality and they don't believe it because maybe they haven't seen it in someone close by. So they don't believe it. A lot of people don't have trust with media. So what they hear in the media, maybe they just blow off and say, oh, that's just the media trying to promote something. And then the internet also has a negative side to it too, because there's a lot of conspiracy theories that are going out, a lot of videos that is misleading people, because a lot of people, they just search something and they don't know if that's a reliable source.
Are out there, but you are the source. Can you please tell our listeners that you have seen COVID patients, that it is a real thing from a doctor's perspective?
Yeah, I've seen COVID patients and it's as real as it is being described in the media. And I will tell you that there have been patients that you expect that they are low risk, they're healthy young adults, and you say, oh, they've come in with COVID and they'll be fine. But then in the next couple of hours, they're gasping for air, and then whatever support you try to provide them doesn't help, and they end up dying. So yes, that is happening. That is very real.